Hi, I'm Dr. Emma-Leigh Senyard. I'm a clinical psychologist with a PhD. You might have heard of EMDR. What is it? Why are people talking about it? Well, EMDR, eye movement, desensitization, and reprocessing is a well-researched form of psychotherapy that can be really helpful for people who've experienced trauma, distressing memories, phobias, or ongoing emotional stress. EMDR was developed in the late 1980s by Francine Shapiro, an American psychologist who developed EMDR after noticing that her own spontaneous eye movements during times of stress seemed to reduce the distressing impacts of thoughts. She later conducted formal research on the technique and developed EMDR as a structured psychotherapy. Unlike some therapies that focus heavily on talking through every detail of an event, EMDR focuses directly on the memory itself and aims to change how that memory is stored in the brain. So the goal is to reduce the emotional intensity and help you develop more balanced, compassionate beliefs about yourself and the experience. So this means after EMDR, you may feel like the event was in the distant past. You are no longer experiencing sensations or flashbacks and so on that make it feel like the event is still happening here and now. So during an EMDR session, we guide you to focus on a specific memory, including the image, the thoughts, and the beliefs that you have about yourself and others, but also the emotions and any body sensations. At the same time, you engage in bilateral stimulation. Most commonly, it's side-to-side eye movements. You might follow my finger moving across the screen, or we might use taps or sounds. This bilateral stimulation is thought to help both sides of the brain communicate more effectively and to unstick traumatic memories that are stuck in a distressing form, so they can be fully processed. Neurological research suggests that the rhythmic horizontal eye movements can be used in EMDR to reduce activity in the brain's fear circuits and actually increase the hippocampal volume. Over several sets of stimulation, the vividness and emotional intensity of the memory usually decrease, and more adaptive, realistic beliefs start to take hold. For example, I am unsafe moves to I survived, I am okay now, I am safe now. So EMDR is best known for treating post-traumatic stress disorder, PTSD, and it's also recommended by many international guidelines now as a first-line treatment for PTSD. But it can also be helpful for other things that people might not realize, like anxiety, panic, phobias, as I mentioned, depression linked to difficult life experiences, distressing memories from accidents that don't classify as PTSD, assaults, abuse, significant losses, ongoing feelings of shame, guilt, low self-worth and self-esteem, and some complex trauma as well, where symptoms have built up over many years. EMDR is a way to support your natural healing process and help your nervous system process what's been stuck. There is strong research support for EMDR, especially PTSD. We've got some large reviews of studies, including randomized control trials, that show that EMDR can significantly reduce the trauma symptoms, and it often works more quickly than some other trauma-focused therapies. So EMDR is not a one-size-fits-all approach. It may not be effective or appropriate for everyone at any stage. It may not best fit or may need to be adapted for people, including those who are in a high-risk situation, so potentially severe abuse, self-harm, suicide risk, or if you don't have adequate safety and support in place. If you're experiencing acute psychosis or severe psychosis, or you dissociate a lot and you are unable to stay grounded in the present moment, or stay connected to the here and now, or if you're under the influence of any alcohol or drugs or anything else that might interfere with your memory or the process of bilateral stimulation. For some people, you might not actually be ready to focus on the traumatic material, even though you want relief. So EMDR may also not be suitable for you. We might focus instead of bringing down your baseline stress. For some people, EMDR can feel counterintuitive or uncomfortable at first. So for example, focusing briefly on a distressing memory, even though you're not potentially telling all of the detail in full, can feel really unsettling, and eye movements and taps and so on can feel unusual or awkward or strange, and it can bring up strong body sensations or emotions, which can be surprising if you expected it to be more calm. Some people also worry that they might feel worse after a session, but that is common for emotions to feel a little bit more intense while the nervous system processes the situation. Your therapist will take you through a grounding exercise when you finish though. In these cases, we want to slow down the EMDR, or we can modify it, or we're going to focus on stabilization, safety, and nervous system regulation before we then try EMDR or any sort of trauma processing. So it is, of course, important to work with an experienced, trained clinician who has substantial training in EMDR to make sure that they're looking after you, to make sure that you're grounded, to make sure that the intensity of EMDR matches where you're at